Hello, my name is Jacob McCarty, and the microbe that I picked for the video is Salmonella typhi. It's a bacteria that causes disease such as typhoid fever. The scientific name is Salmonella typhi. The genus is Salmonella, the species is typhi, and a common name is Salmonella or Salmonella disease. And on the top right here, the top picture shows a real picture of what Salmonella typhi looks like. And then the bottom one is just a computerized version, but shows you the structure, what they usually look like. So what are the diseases that are caused by Salmonella typhi? So the main one is typhoid fever. Many kinds people can get this from different ages. Nobody is protected, basically, from getting this disease. Other two diseases that are caused by this is parathyroid fever and salmonellosis. All of these diseases share a characteristic. They all cause fever, of course, but also they all cause nausea and vomiting, and this overall breakdown of the body, like a weakened immune system. CDC is a great website to go to if you do want to understand more about typhoid fever and the other diseases that are caused by Salmonella typhi. That's basically where I went to for most of the information for this PowerPoint, and very reliable too. Typhoid fever. So these are some of the signs and symptoms. So you see right here, white coating on the tongue. Down here, Salmonella typhi. You can get it from contaminated water, distilled water, or even water from like a private well or a contaminated river, possibly you can get it from. Rash on the body, enlarged liver and spleen right here, and then ulcer in the intestines, small and large intestines. Basic background on Salmonella typhi would be they have flagella and they're gram-negative in structure. They're facultative anaerobic bacilli. Basically, that means that they thrive on areas with no oxygen, so they don't need oxygen to survive and to multiply and to spread. Contains VI, O, and H antigens from the periodic table, and can multiply and spread very quickly if not sustained in the beginning stages. It's very important to know that Salmonella typhi can be spread from person to person or from feces, specifically feces. And it's very important to wash your hands and when necessary wear masks and the proper gear, like a gown or gloves when needed. Organisms commonly infected by Salmonella typhi would be birds, cold-blooded vertebrates, and reptiles. Birds are one of the biggest ones because they can go anywhere. In long distances, they can fly from one place to another, one tree to another. So it's very important to understand the area that you live in and to watch the news if there's an increase of typhoid fever or anything related to the salmonellosis. Bovine animals, pigs, and small large horses, farm animals, and cattle can carry this disease. So make sure that if you live on a farm, if you live out in the country, and you have animals, that they are tested if that needs to happen, and also that your family takes the right precautions to prevent any spread of salmonellosis and typhoid fever. Humans with contamination via feces can also be at risk, so make sure to wash your hands. where is Salmonella typhi usually found in the environment and in the world? So it is found in non-industrialized countries. So, but U.S. residents or citizens can still get this disease, but it's less likely. You're more likely to get it in places that are not industrialized and not well developed. And such countries could be eastern part of Europe, Asia, Africa, and Latin America. And also crowds. Crowds of people in the cities and the streets are big contributors and factors at getting this disease because there's more people that are more at risk, especially people that have weakened immune systems, and also people that have low digestive abilities to digest their food. It is found in the large and small intestines of people and birds. Like I said, the digestive system has a huge part of this. So your digestive system can't digest food properly. It can cause a backup of the feces, and that could lead to typhoid fever. And that typhoid fever can also lead to other diseases that can weaken down the immune system. And right here is another picture, a real picture of Salmonella typhi. So how is Salmonella typhi transmitted? Transmission comes from consuming foods that is contaminated by feces, consuming raw meat, fish, and chickens, raw eggs especially, if not well boiled and examined for consumption. Fruits and vegetables, if contaminated by feces, and ingestion of bacteria and contaminated food or water. So consuming foods and water that's contaminated and polluted with feces related to Salmonella typhi can cause your body to weaken, and also can cause a spread. And when there's a spread, like I said, it can spread very quickly. So always wear your mask in any kind of outbreak. And the water that you consume, make sure it's clear and it doesn't have any pollutants. Usually, not always, but sometimes you can look at the water and see if there's anything wrong with it, and there's any issues, you should probably get it checked out in your pipelines too. The signs and symptoms of Salmonella typhi are the following. These are like the minor ones. The minor would be nausea, migraine. Bloody stools are kind of minor, but not as bad as the other ones I'm about to talk about. So bloody stools, abdominal pains and aches, fever, and loose stools like diarrhea, watery stools, or some of the minor signs and symptoms. The major ones would be dehydration, such as decrease in reduction of urine, and then also a decrease of output in feces, of being able to make any bowel movements. So the backup of that could be possibly could lead to bacteremia, which is like the buildup in bacteria in your body, which causes weakened immune system. And reactive arthritis could be a lack of balance, pain in your joints, and also it could cause a lack of focus too, but lack of locomotion. And then if you're not safe, you could fall and it could injure your body even further. So dehydration, bacteremia, and reactive arthritis are the main three serious signs and symptoms you can get from this. Vaccines and treatments available for this. So there's not really any vaccines yet. I believe in articles and research experiments that I've read, they found certain vaccines, but they're not all the way applicable for this disease. So the main is its treatments to reduce and to prevent typhoid fever and salmonellosis. So the treatments are antibiotics and antidiarrheals for the bloody stools and for the diarrhea, basically. Loperamide would be the specific medication for that. Ciprofloxacin, Cipro, would be for non-pregnant women. If you're pregnant, you don't need to take this because it could it can harm your baby inside you. So you don't need to take this if you are pregnant. Ceftriaxone, the specific name would be Recefin. Ampicillin, such as Omnipin, Polycillin, and Principin, and Trithroprim. The specific medications of that would be Bactrim and Cetera. So basically, antibiotics, antidiarrheals, and ampicillin are the main ones that could help you. Now, you can basically use that depending on the age, though, but anyone 12 and up can take those medications. And then depending on who the child is and how well their immune system is, they can even take it probably even younger than that too. So just talk to your doctor, talk to your physician and your nurse to make sure that if your child is younger than 12, that they're able to take this safely without causing any more harm to them. And these are all the references that I use. So, okay. So in conclusion, Salmonella typhi causes typhoid fever, salmonellosis, and parathyroid fever. And the high fever from that can cause many other diseases. Specifically, the transmission is feces. So washing your hands constantly is a huge contributor of reducing the spread of this disease, and also keeping children safe and people in healthcare safe too, because people in healthcare are more likely at risk because they're taking care of patients that could get it or do have it. And also to make sure that if you have any signs and symptoms, go to your doctor and physician to get the help that you need, and to be just more informed about what Salmonella typhi is, because it's a disease that can be pretty serious, but if you treat it in the beginning stages, it's less likely to cause any further damage to your body. So thank you for watching, and hope you have a great night.